Hello friends, today I am going to tell you complete details about the kidney stones. What is kidney stones, why it is happen, what are the treatment options available and what are the preventive measures. So first of all we will cover what is kidney stones. Generally this is the small hard deposits of the minerals and the salts, and it is accumulated in the kidney and forms the stone like structures. The other terminologies of these hard deposits are called as renal, calculi, nephrolithiasis and the urolithiasis. Then we will know the types of the kidney stones. The first of all, calcium oxalate stones, calcium phosphate stones, uric acid stones and the struvite stones. Generally these calcium oxalate stones are formed if you are taking the food rich in oxalates like the green leaves, nuts, seeds, sweet potatoes and the chocolates. Then you will go for the uric acid stones. Basically these stones are formed due to the high intake of the animal foods, because in these animal foods there is high quantity of purines. Due to the high quantity of purines, this leads to the high production of the monosodium urates, and under right conditions these monosodium urates form the uric acid stones. Okay, then you will go for the calcium phosphate stones. This type of stones are formed due to the high alkaline of the pH, high intake of the salts and certain medical conditions like hyperparathyroidism, in which the calcium levels are increased in the blood. Okay, and another medical conditions is the irritable bowel syndrome, in which the absorption of the calcium is decreases in the intestine. Due to this reason the calcium phosphate stones are formed. Then finally we will go for the struvite stones. This type of stones are formed due to the urinary tract infections caused by certain bacteria like the Proteus, Pseudomonas and the Staphylococcus. Okay, so basically these type of bacteria produce the more ammonia in the urine. Due to this forms the struvite stones. Okay friends, so this was the type of the stones. Then we will go for the symptoms of the kidney stones. The first symptoms is the pain and burning sensation while urinating, and pain at the lower abdomen, fevers, chills, nausea and vomiting, the dark color of the urine, blood in the urine smells bad, the cloudy urine. So these are the symptoms of the kidney stones. Okay friends, so then we will go for the diagnostic tests. Okay, these tests include the urine test, blood test and certain image testings. In the urine tests, this reveals some infections, some microscopic traces of the RBCs and some pus cells and other elements that causes the kidney stones. And in the blood test, the doctor will get to know the calcium or the uric acid in the blood and other diseases of the kidney. Okay, then third one is the image testing. In this testing, the doctor will generally advise some X-ray, CT scan and ultrasound. In the X-ray, the mostly the KUV X-ray is preferred. And second one, the CT scan or the ultrasound. Generally, here the ultrasound is more preferred than this test, because in this test the doctor will get to know the morphology of the kidney and the morphology of the as well as the stone, and the size of the stone and the location of the stone. So by analyzing these tests of the urine, blood and the imaging test, then the doctor will suggest a treatment plan which will be the better treatment plan. Okay, after analyzing these reports. Then we will go for the what are the treatment options available, okay, to remove the stones. So the first line treatment is the oral medications. Second one is the lithotripsy, and another is the ureteroscopy, and the fourth one is the percutaneous nephrolithotomy. Okay, then we will go for the oral medications. In oral medications, if your doctor suspects this is the uric acid stone, then the first drug of choice is the allopurinol. Then allopurinol is the xanthine oxidase inhibitor, okay, or is a purine inhibitor, and which lowers the uric acid in the blood and which inhibits the formation of the uric acid stones. Then second one is the alpha adrenergic blocker, and these alpha adrenergic blockers, this is the relaxes the smooth muscles of the urinary tract and which helps to remove the kidney stone easily from the bladder or urethra. In the alpha blocker, the drug of choice is the tamsulosin. Then another drug of choice is the cistern fort. This is purely Ayurvedic medicines and mainly the contain the Pasan Health is the Ayurvedic ingredient and which have the triptolytic activity, means which breaks the kidney stones into the small pieces and helps to remove the kidney stones from the body. Then if the doctor suspects there is some infections in your kidney or urinary tract infection, then the doctor will suggest some antibiotics, okay. The antibiotics like the ofloxacin, onidazole, levofloxacin, or some combinations of ofloxacin, onidazole, some ofloxacin, cefixime. Oh, these are some antibiotics. If you have some stroid stones, okay, in these stones the doctor will prescribe acetohydroxyamic acid, okay. What happened, this acetohydroxyamic acid which lowers the production of the ammonia and ultimately it decreases the ammonia level in the urine and which inhibit the formation or aggregation or growth of the further crystals or the stones. Then friends, another medicine is the stone 1b6, okay. In this stone 1b6, the main component is the magnesium citrate and the vitamin B6. Then the doctor will prescribe some NSAID non-steroidal anti-inflammatory drugs. These are used to reduce the pain, inflammation, fever, okay. The drugs the mostly prescribed is the Zerodol SP. If you have colic pain, then doctor will prescribe some Buscopan Plus or some Drotin A, Meptal Spas. So these are the NSAID drugs. Then generally if you have the kidney stones, then patient suffers from the vomiting, okay. So to reduce the vomiting, doctor will prescribe some anti-emetic medicine, that is the ondansetron. So friends, these are the oral medication therapy. Then you will go for the another treatment option, that is the lithotripsy. In the lithotripsy, it uses the high energy shock waves which breaks the large stones into the small pieces and finally passes from the urinary tract and passes from the body. And another is the ureteroscopy. In this, ureteroscope is passed through the urethra into the ureter to remove the stones by using a laser, okay. Then another treatment option is the percutaneous nephrolithotomy. It is minimally invasive procedure to remove the kidney stone from the body by incision of the skin. Actually this is some surgical procedure, okay. So friends, this was the complete treatment of the kidney stones. Then we will go for the preventive measures of the kidney stones. Generally I will advise drink plenty of water. Okay, hydrate your body all over the day. Restrict the intake of non-veg foods. Take the intake of calcium dietary foods. Restrict the intake of salts and take more citrus foods, and restrict the foods which is rich in the oxalates. Then finally I will recommend dilution is the best solution for the pollution. Okay, hydrate is the safe and effective therapy for the all stone former. So friends, these were the complete treatment of the kidney stones. If you have some any doubt, then write on the comment box. If any doubt or any suggestions, I will try to resolve. Okay, so thank you friends. Jai Hind, Jai Bharat.